Welcome to the Libman Education Coding Clinic Commentary Update for ICD-10-CM and PCS, second quarter 2023. My name is Faye, and I will be hosting this session of our update. A patient with diffuse interstitial lung nodules, cervical lymphadenopathy, and thrombus of the right internal jugular vein and superior vena cava is admitted to rule out malignancy. After undergoing an excisional biopsy of the supraclavicular lymph node, the patient was found to have stage 4 non-small cell lung cancer with metastasis to the cervical lymph nodes. How is this correctly sequenced in ICD-10-CM? Coding Clinic advises reporting the primary non-small cell lung cancer as the principal diagnosis and the cervical lymph node metastasis as an additional diagnosis. Coding Clinic references ICD-10-CM Official Coding Guideline 1C2A, which is Admission Encounter for Treatment of Primary Site. It tells us if the malignancy is chiefly responsible for occasioning the patient admission or encounter and treatment is directed at the primary site, designate the primary malignancy as the principal first listed diagnosis. The only exception to this guideline is if the administration of chemotherapy, immunotherapy, or external beam radiation therapy is chiefly responsible for occasioning the admission or encounter. In that case, assign the appropriate code from the Z51 category as the first listed or principal diagnosis and the underlying diagnosis or problem for which the service is being performed as a secondary diagnosis. Coding Clinic also references ICD-10-CM Official Coding Guideline 1C2B, Admission Encounter for Treatment of Secondary Site, which tells us when a patient is admitted because of a primary neoplasm with metastasis and treatment is directed toward the secondary site only, the secondary neoplasm is designated as the principal diagnosis, even though the primary malignancy is still present. This concludes the Libman Education Coding Clinic commentary for second quarter 2023. Thank you for joining us for this presentation.